AI. Headlines are saying AI is able to read CT scans. It can detect cancers, pulmonary embolisms. Now, headlines are saying that radiology might be dead. Should doctors be worried? This is the conversation we're going to have right now. Over the past years, artificial intelligence has been shown to be significantly impressive. And what I mean by that is, we can see that artificial intelligence is able to match or even exceed the levels of radiologists when analyzing breast tissues, lymph nodules. So that's where this massive claim of is radiology being replaced is coming from. But what does the data really show? What does the research really look like? So, one thing that's driving this fear is that in the US Food and Drug Administration, over 700 artificial intelligence and machine learning has been cleared, and most of it is in the field of radiology. But if you look inside that article, it also says it's to help with workflow load, it's to help with optimization, it's to help with triaging. So it's showing that artificial intelligence is being used as a assistive technology rather than being a replacement. A systematic review published by JAMA Network Open showed that artificial intelligence is great when it's in a controlled lab setting or when it's the same people in the same hospital and it's analyzing the data there. But the minute we start branching to different areas, different regions, different hospitals, then that's when the accuracy of AI tends to go down. And in this, we see that AI is having a hard time adjusting to clinical practices because it's so used to lab based control settings. The field of radiology is more than just looking at slides. It's about looking at patients' history. It's about comparing prior studies. It's about being able to properly communicate with the families and being able to communicate urgent findings. So the question is not necessarily does AI work? Because based on the Lancelot digital studies, we know that AI can be proficient. The issue is that if artificial intelligence was able to find a, let's say, breast cancer, and then we found out maybe the breast cancer wasn't there, or even if it was, can artificial intelligence communicate with the family? Can artificial intelligence be able to take on any liabilities in case maybe the breast cancer wasn't there? Maybe it is there. Is artificial intelligence able to have that humanistic aspect that all physicians need and that clinical experience that's needed? As of right now, no. AI is very good at pattern recognition. So, with this study, it really is showing that AI and a radiologist together can improve efficiency, but not necessarily having one replace the other. Another point I want to bring up is that artificial intelligence also has a bias to it. And what I mean by that is that artificial intelligence works by being fed data given to it. And sometimes that data isn't representative of the population, doesn't include diverse populations. I believe I saw a study where artificial intelligence only includes maybe 10% of African American populations. And when we're using such a tool like artificial intelligence, yes, it has high accuracy, it can be more efficient, but when it comes to more diverse populations, then we see that accuracy going down. And I read this example that when it comes to like even darker skin tones, and that's many populations, that the accuracy goes down because the pattern recognition is not the same. So this is another reason why artificial intelligence is not ready to make all these claims being made. It's used as an assistance, not to take over, because it can't accommodate diverse populations. Another point I want to make is that the American medical colleges is still saying we're in a physician shortage, and that physician shortage can last up to 2036. We're in 2026. So, with that, we also have an increase in aging populations, which means we are going to have more of a demand for radiologists. And also, it goes back to my previous point to say that radiologists needs to be there to help with the diverse populations because artificial intelligence can't yet do that. And this country is much more. It's a melting pot. It has so many different people, so many different ethnicities. The last point I want to make is that artificial intelligence in radiology, it is used to help prioritize critical cases, to help with the workflow, to increase the efficiency. It is not used to automate roles, to automate tasks. It is used as an assistance. So, is artificial intelligence replacing radiologists? No. Is artificial intelligence helping to help radiologists in their workload, to help kind of figure out what's happening with the patient quicker? Yes. So it's not a conversation of artificial intelligence versus physician. It's how can we integrate the two to be a better physician, to help the patient more, to provide better care, more efficient and more accurate. And that is the combination of the two, not one replacing the other. I also put the sources in the description in this video, and I really appreciate you guys listening for it. And I'm very passionate about medicine, changes in medicine, what is happening in medicine. If you want any other topics related to artificial intelligence or just anything else, I can definitely take the time to research it and have a great conversation with you guys. Thank you so much for watching. Have a great day.